I got corona at the end of January. Since then, I have had long COVID. It started with fatigue, shortness of breath, sleep disturbances, and it stayed throughout the months. Accordingly, I then went to the family doctor, then to the cardiologist, sent everything. No one could help me.
We had another extremely exciting case of a patient who was double vaccinated and boosted with BioNTech, and subsequently developed a corona infection. Following this corona infection, the patient was barely able to work. Her performance was drastically reduced, in her own words, by about 80%. The patient was previously fit, healthy, took part in life normally, went to the gym and could do everything, could work for hours and so on, and then almost nothing worked.
And then in May, I got the first apheresis, and it was really an insane difference. One day before the apheresis, I was feeling really bad again. I was so exhausted, and on Tuesday I had the apheresis, and the next day I noticed already in the morning that this exhaustion, this heavy, was gone. During the week, I also noticed that I no longer had shortness of breath when I walked one floor. After the second apheresis, it is now like this. I can walk 2 floors without arriving at the top and having shortness of breath. And also, I don't have any fatigue anymore. You can say I have my life back.
The patient reported a very significant improvement, that she had regained almost a normal life, already after the first apheresis, and is back to normal everyday life, can do everything, similar to before at best with minor restrictions, if any. We have not been able to detect the typical antibodies in this patient. There are certain autoimmune antibodies. The adrenergic and muscarinic antibodies were not detectable. However, angiotensin-converting enzyme, called ACE, was significantly decreased following the vaccinations and following the corona infection. It is not possible to differentiate exactly what was causative here until the vaccinations or the corona infection. In any case, the inflammation caused by the infection was reduced, in the sense that the patient was able to regain her normal performance.